So gallstones are small stones inside the gallbladder, which are formed inside gallbladder. Gallbladder is a site where bile is stored, which is produced in the liver and stored in the gallbladder. Whenever we eat food, gallbladder contracts and send that bile into the bowel for the digestion of food. Stones are formed inside the gallbladder. If bile becomes very concentrated, it starts with a tiny nidus of, and then slowly things get accumulated on top of that, and it can get bigger. Gallstones can be there asymptomatic, which is not causing any problem. And if it's just incidentally found on the scan, that doesn't necessarily require any treatment, but it should be seen by specialist and advice taken. But if gallstones are causing problems, then most of the time operation is the definitive treatment, which is to remove gallbladder. So gallstones, the main symptoms are pain in the upper part of the tummy, which is mostly on the right side, vomiting, or if that gallstones cause any complications like infection, which can cause a lot of inflammation around gallbladder, which will be continuous pain along with the fever and very tender to touch that part. Sometimes gallstone can migrate and cause blockage in the bile duct, which cause jaundice. Sometimes the gallstones can migrate and upset the pancreas and cause pancreatitis, which can be life-threatening. So there are a lot of consequences of the gallstones which cause complications, and then it should be treated. Treatment depends on what complication gallstone have caused. Mostly, ultimately, treatment for the gallstone is keyhole operation to remove the gallbladder. But if it has caused pancreatitis, then how to let pancreatitis settle. If it has caused jaundice because of the blockage, then need to clear the bile duct as well, which again has got two ways to do, either endoscopically, it's called procedure called ERCP. You can remove stone through that, or while removing gallbladder, you can do laparoscopic or keyhole operation to remove the stone from the duct as well. So it's a variety of things which can happen, and then variety of treatments for those complications. So complication can happen. Cholecystitis, which is inflammation of the gallbladder. Before that, just frequent attacks of biliary colics, we call, is just gallbladder upsetting, gallbladder getting pain and that getting better. Obstructive jaundice because of the blockage of the duct, or pancreatitis when it upsets. Sometimes gallstones get into the duct, cause blockage, and then infection spreads from the bowel into the liver, which is called cholangitis, which causes severe or high-grade temperature and severe pain. So these are the main complications which can happen if these gallstones are causing problem and not treated promptly. If there were no symptoms related to gallstone and stones are not too small, they are not causing any pain or any symptom, incidentally found on scan, which was done for something else, then there's no real need to remove, because what we have seen that complications happens most of the time after some symptoms. So if it's completely asymptomatic and it was found on scan, which was done for some completely different thing, then we don't necessarily need to treat those. But in those situations, should get opinion from a doctor before leaving those. But most of the time, these one don't require operation to remove. There may be some dietary modifications, such as low-fat diet or healthy diet,